I inquire if we're in a quorum call?
We are.
Qual. Could I ask the quorum call be suspended?
Without objection.
Mr. President, I rise to talk about the replacement plan for the Affordable Care Act that's being considered by the House. In December, I was informed that I was going to get one of my dreams to come true in the Senate. I had asked to be on the Health, Education, Labor, Pension Committee when I came in January of 2013, and I was not on the committee. I had no complaints because I had other good committees, but I was told in December that for this Congress I would be added to the committee, and I'm thrilled to serve on it. When I found that I was going to be added to the committee, I knew one of the first issues we'd be tackling is what to do about the Affordable Care Act, and I've started to pay visits around the state to as many stakeholders as I can. Patients, doctors, medical students, hospitals, behavioral health facilities, allied health training programs in regions all across the state, military families in Hampton Roads just last Friday, as well as patients and their families in Chesterfield County last Friday. And in all of these visits, my question has been, we're going to be tackling the Affordable Care Act. Tell me what works, what doesn't work, and what can we do better? And that's been the goal. The committees in the House, two committees, are considering a plan that House Republicans have put on the table and are touting as a replacement of the Affordable Care Act. And I just want to talk about what it would mean if passed to Virginians and Americans. This plan will reduce the number of Americans with insurance. We've dropped the uninsurance rate to a historic low, but the gains that we've made would be reversed. The numbers of Americans with insurance would go down. It would raise health care costs, particularly on seniors, in a way I'll discuss in a minute. It would dismantle the Medicaid program at the service of tax cuts for the wealthiest. It is not an adequate replacement. In fact, it would be a dramatic retreat, and it would be a retreat that would violate promises that have been made by the President and other leaders. Republicans, and I'll get into this, have made a number of promises about what a replacement would look like, but this plan falls far short of that, and that's why within 36 hours of it being put on the table, stakeholders across the spectrum, the American Hospital Association, AARP, the AMA, nurses, nursing homes, Republican governors have come out either to dramatically and flatly oppose this plan or suggest significant concerns with it. The bill has yet to be scored by the Congressional Budget Office, but the House is trying to push it through committee and even through the floor if they can before the CBO tells the American public what this plan would cost, and every bit as importantly, what it would cost Americans in terms of the number of people who would lose their health insurance. A very poignant comment about the plan that was in the paper this morning was from the Republican governor of Nevada, Brian Sandoval, who said, "We Republican governors have talked to Congress and said, please pay attention to what we have to say. States bear a huge burden on these programs, especially Medicaid." He said, "We gave ideas to the leadership, to the majority about the replacement, but none of our ideas are in this plan." Without a CBO score, the American public and this body is completely in the dark about how many people will lose coverage and about how this will affect the American economy. Why would we move forward? Why would we try to push a vote, even in a committee, much less on the House floor, before the CBO has given us this score? We don't serve the American public well by doing it. What does the bill do, the replacement bill do? One, it ends the expansion of Medicaid that was a core component of the Affordable Care Act, the expansion that has been embraced by more than 30 states. And then it takes the traditional Medicaid program and really dismantles it, instituting a per capita fee for enrollees and moving it more to a block grant program. That's the first thing it does. Second, with respect to seniors, this plan would repeal a provision in the Affordable Care Act that says seniors cannot be charged more than 3 times the premium of a young person. It would repeal that, and it would allow insurers to charge older customers 5 times as much as younger customers. And it would give states the ability to even set more unfavorable ratios for seniors. This will have a significant impact on the premium of every older American. And third, the plan repeals the income-based subsidies, premium assistance, and cost-sharing reductions in the current Affordable Care Act and substitutes less generous tax credits that won't be adjusted to average costs of plans in particular markets. So if you're a middle-income individual in a high-cost market, you are really out of luck in this plan. Let me just give you an example of how insurance would be affected in particular communities all over Virginia if the House plan were adopted. If you are 60 years old and you make $30,000 per year under the House plan, here's what happens. First, the cost of your insurance can be dramatically raised because you're not at age 60 now limited to 3-to-1 over a young person's premium. They can charge you 5-to-1 over a young person's premium. So the premium cost, if you're a 60-year-old making $30,000, goes up significantly. Now, you get a tax credit, just like right now you get a subsidy, but the tax credit is much less generous. So the cost of your policy goes up, but here's what happens in communities all over Virginia: tax credit compared to the subsidy you currently get. In 2020, in Augusta County, Virginia, in the Shenandoah Valley, the tax credit you get is worth only about half of the subsidy you would get if we continued the Affordable Care Act. So price is up, but your tax credit is less generous by half of the current subsidy. In Fairfax, your tax credit is 41% less than the subsidy. In Bedford, 51% less than the subsidy. In the city of Norfolk, 51% less than the subsidy. Rockingham, 50% less. Pennsylvania, 49% less. Pulaski County in far southwest Virginia, 54% less. So if you are a senior, your costs go up, but the assistance you get in the tax credit is dramatically less generous than the assistance you currently get with the premium subsidy. The bill establishes a penalty if you don't have continuous insurance. An insurer can charge you 30% more in premiums if you go 2 months or more without insurance. So if you're unemployed and lose your insurance, if you forget to pay a premium for a month and you lose your insurance, if you have any gap of 2 months, that is an opportunity for insurers to come in and sock you with a massive penalty. The bill repeals funding to a health care provider of choice for millions of American women, Planned Parenthood. It's really important to be specific about this. There's not in the federal budget a line item, Planned Parenthood gets X. What federal funds go to Planned Parenthood? Well, first, the Hyde Amendment says no federal funds can go to any organization for the provision of abortions, Planned Parenthood or anybody else. Planned Parenthood receives federal funds because it provides health care to women who are eligible for Medicaid. So when Planned Parenthood treats a woman who is Medicaid eligible for a medical service that is eligible for a Medicaid reimbursement, then Planned Parenthood is able to bill Medicaid just like a doctor's office is. And Planned Parenthood is the health care provider of choice for millions of American women to do annual checkups, pap smears, cervical cancer tests, all kinds of basic health care provisions. But under this bill, Planned Parenthood will be disbarred from the Medicaid program, even when they're providing services to Medicaid-eligible women, services that are covered by Medicaid. The one thing about this bill that I would say, if you're going to say, well, like, who's a guaranteed winner in this bill? Because there's a lot of losers, and I've tried to summarize it. The guaranteed winner is this bill overwhelmingly repeals the provisions that raise revenue. This bill is a big tax cut bill. The biggest revenue raisers in the Affordable Care Act were tax cuts on the wealthiest citizens. There was a tax increase for non-wage income by the top earners in the United States, and an additional hospital tax that also affected individuals of high income. What this bill does is cuts taxes that almost exclusively benefit the wealthy, while the bill is taking away these coverages and provisions that protect middle and lower income Americans. The tax cuts in this bill would save the top 0.1% of earners in the United States about $195,000 a year. So if you're in the top 1% and this bill passes, you're going to get a $195,000 tax break. Millionaires get 80% of the value of the tax cuts in the House bill, with the elimination of the hospital insurance tax on high earners and the Medicare tax on unearned income. In fact, a family that is going to do incredibly well under this bill is the family of our president, Donald Trump. As a high earner, they're going to get a huge tax cut in this bill. And Mr. President, I got to ask, is this bill a health care bill? Or is it basically a tax cut bill? You could look at this bill as basically being the driver of it, who benefits from it. It's a tax cut on the wealthy paid for by slashing Medicaid, slashing health care coverage, slashing Medicare, slashing Planned Parenthood, taking protections like pre-existing condition that really matter to people and reducing them. So I have a real question about whether this bill is a health care bill at all, or whether under the guise of a repeal and replace ACA, it is a tax cut on the wealthiest financed by slashing the health care safety net. Let me read you what certain leaders, Republican leaders, have said about this bill in the past. The deputy leader here in the Senate, a friend from Texas, Senator Cornyn, said to Republican governors have a lot at stake in this. I was a governor. I know how much governors depend upon Medicaid and health care programs. Here's what Senator Cornyn said, January 19, 2007, quote, "Nobody's going to lose coverage, period, close quote. No exception, no qualification. Nobody's going to lose coverage." That's what he said to the Republican governors. We're awaiting the CBO score suggesting potentially how many millions will lose coverage. Many people will lose coverage. That's not what was promised. But more importantly, probably, what did the president say? When the president was campaigning as a candidate, this was what he promised the American people. Quote, "I'm going to take care of everybody. I don't care if it costs me votes or not. Everybody's going to be taken care of much better than they're taken care of now." That was the test that he set for himself about an Obamacare replacement. That no one would be worse off and that many would be better off. This does not meet that promise. It fails that promise. And in a December press conference, the majority leader, Senator McConnell, said, "Surely we can do better for the American people. We'll work expeditiously to come up with a better proposal than current law." Again, the promise was we will take where we are right now and we will make it better. Nobody will lose coverage. Everybody will be taken care of better. We will come up with a better proposal than the current law. This is not that proposal. Turning Medicaid from a federal guarantee to a per capita cap on spending doesn't mean everyone is covered. It means cuts to states that would force states to cut eligibility, reduce benefits, or provider payments. And that's why providers like the Hospital Association of Nursing Homes and Republican governors like Governor Sandoval are deeply opposed to this particular version. It's not better for the American people. Protecting people with pre-existing conditions, which the current bill does, but only if they have continuous coverage, that's not better for the American people, because what if you lose your job or you can't afford benefits or you have a break in coverage for 1 month or two and then you suddenly find that you're not protected and your pre-existing condition can be used against you to bar you from insurance for the rest of your life? If you're unemployed and have a break in coverage, how do you afford a 30% surcharge on health insurance premiums like this plan proposes that insurance companies can sock you on? That's not better for the American people. So in closing, Mr. President, I'm just going to repeat something that 13 Democrats put into a letter to Republican leadership in January. We want to work together to try to make health care better. We're willing to sit down at a table, and we have ideas for how to improve not just the Affordable Care Act, but prescription drug prices under Medicare Part D, something that our citizens are deeply concerned about. We need to work together on affordability. We need to work together to make sure small businesses are able to afford coverage. We got to bring prescription drug pricing down. I know Republicans have ideas about how to do that, and Democrats do too, and the time is now to sit down and try to figure that out. But passing a precipitous repeal, trying to rush it through before the CBO scores it, a precipitous repeal that would take health insurance away from many, that would jack costs up on seniors, that would punish so many Virginians by reducing the subsidies they get now and replacing them with a less generous subsidy, that will break a promise that the president made. That will break a promise that other leaders have made. I'll conclude and say this. We had a HELP committee recently where we had witnesses who had been called by Democrats and Republicans before us talking about things that we need to do to fix and improve the Affordable Care Act. And they all agreed that we needed to find improvements and fixes. All of them, Democrat, Republican, Independent, they all agreed we needed to find improvements. They all agreed that a repeal of the Affordable Care Act would be a catastrophe. And so I said, so look, if repeal is a catastrophe, but we need to make improvements, I asked them all this question. There were 4 witnesses. I said, if we need to make improvements, what is the best way to do it? Should we do it fast, careless, and secret? Or should we do it slowly, deliberately, and publicly, transparently? And they all said, well, of course. I mean, there's only one answer to that question. We're talking about people's health. We should do it deliberately, carefully, and transparently rather than fast, careless, and secretly. We are proceeding right now in the fast, careless, and secret mode. This particular plan, comically, was locked in a room and nobody was able to see it last week. And one of our Senate colleagues went over and tried to get in to see what was in the plan, a Republican colleague, senator from Kentucky. Now that the plan's out in the light of day, I think we can see why they were hiding it, because it's got so many elements that are frightening so many people. We can get this right, Mr. President. We can get this right by sitting down and having a discussion about what I've been talking to my constituents about. In the healthcare system right now, what works, what doesn't work, and what should we change? And if we bring constituents around the table, individuals, hospitals, insurance companies, pharmaceutical companies, businesses that are trying to buy insurance, doctors and nurses, if we get people around the table, they'll break us out of the them versus our thing. We listen to them. We ask them those questions, what works, what doesn't, what can be fixed. We will find a path to meet the promise that the president made, to meet the promise that Senator Cornyn made, which is not making anything worse, but taking the system as it is right now and making it better. But we will only do that if we engage in a dialogue rather than trying to rush. And that's what I encourage my colleagues to do. And with that, Mr. President, I yield the floor, and I note the absence of a quorum.
The clerk will call the roll.
Mr. Alexander.